Chris is a 45-year-old man who comes to the clinic today after a recent hospital admission for asthma. His physician has asked the on-site pharmacist to review the patient's medications. Watch as the pharmacist uses the SBIRT approach to determine Chris's use of alcohol and drugs.
Hi, Chris. My name is Dr. Lowry, and I'll be your pharmacist for today. So how are you doing?
I'm all right.
Good, okay. Well, I appreciate you meeting with me. Since you recently went to the hospital, your physician just wants me to maybe ask some questions, review your medication, and just see if everything's going well for you. This is just a routine visit for patients after they visited the hospital. So would it be okay if we talk for a few minutes?
Yeah, no problem. Go ahead.
So let's look at your medication list we have here, and we'll review it together.
The pharmacist reviews the medications and then asks pre-screening questions to determine if Chris is using substances that may interact with his medications.
All right, well, I'll share those recommendations with your physician. I just have a few more questions. We routinely ask questions patients as they enter the clinic here and just ask about alcohol and drug use just to make sure that we better understand your health. Would it be okay if we do that together now?
Sure.
All right. Get the questions out. So, first one, when was the last time that you had more than 4 drinks in a day?
Oh, wow. It's been a long time. I mean, probably 10 or 12 years.
Okay, good. How many times in the past 12 months have you used an illegal drug or prescription medication for non-medical reasons?
None.
Okay, terrific. Do you smoke or use any tobacco products?
Yes, I do smoke.
Gotcha, all right. And how much and how often?
I was up to 2 packs a day, and now I'm cut back to just over 1 pack.
All right, good for you. Is it okay if we talk a little more about your tobacco use now?
Sure.
All right. So, tell me, what do you like about smoking?
That's a new one. I haven't been asked that one before. I would say it wakes me up in the morning. It helps me to relax at work. I'm not sure what else, but I've been smoking for quite a while now.
Okay. What are some things that you don't like about smoking?
Well, the price. I mean, they've gotten outrageously expensive, and my girlfriend's been nagging me to quit lately.
Okay. So you like to smoke in the morning, you like to smoke at work, but expense is becoming an issue, and also it bothers your girlfriend a little bit, huh?
More like it bothers her a lot.
Okay, all right. Well, let's see. I have another question. Let me ask you then, Chris, on a scale of 0 to 10, with 10 being the highest and the most important, and 0 being the least important, how important is it to you to change your smoking habits?
How important? 5. I know I should quit, but I really don't want to.
Okay. Now, why a 5 and not something less like a 2 or a 3?
I guess I could use the money for other things like my motorcycle, and I'm sure it would be nice to breathe a little easier.
Right, exactly. So what would have to happen for you to maybe take it from a 5 to something higher, 8 or 9?
I don't know. I just really like smoking. I mean, it helps me deal with work.
Gotcha. Okay. Well, I know that you went to the hospital recently for asthma. Do you think that there's a correlation between your smoking and your breathing quality with your asthma?
Yeah, probably. I have noticed my asthma attacks have been on the rise lately, and you know, I imagine it's something that is a direct correlation to my smoking.
Okay. You noticed a connection between your smoking and your asthma, and I think you're right. Tobacco smoke can actually increase the mucus that is in your lungs and make it more difficult to breathe, especially for someone with asthma or who's combating that. So, what do you think of that?
Well, I mean, it makes sense. My dad was a smoker, and he had a hard time controlling his asthma, and I really don't want to end up like him.
Okay. So you have family connections and family with similar experiences. Well, I recommend that you would at least cut back your smoking, maybe even to the point of quitting. It may help you stay out of the hospital in the future. What do you think about that?
I think I can do that.
Okay. So let's say you started next week. Now, where would you start?
I guess I would get some of that nicotine gum, and then probably only smoke at work, which I'm sure my girlfriend would appreciate.
Okay, good. I like that idea. In fact, I might share that with your physician, and maybe she can set up an appointment with you in the future to talk about that. Does that sound good to you?
Yeah, that'd be great.
Great.
After negotiating a plan, the pharmacist shares the information with the attending physician. As part of the medical team, the pharmacist is a good resource to patients for understanding how alcohol and drug use can negatively interact with important medications. The SBIRT approach is an effective tool to help pharmacists provide such information to patients.